Hello and welcome to Telehealth Training for BTs. We're going to be walking you guys through kind of the general process of telehealth services today. My name is Joey Mazikane. I'm a senior BCBA in the Inland Empire, and I'm joined today by Allie.
Hello there. My name is Allie Kronberger. I am a clinical director over at Children's Learning Connection.
Thank you for joining us, and we're going to be talking about telehealth today. So let's look at our agenda. We'd like to talk about what telehealth is. We're going to give you a general GoToMeeting tour. We're going to talk about setting up a session on GoToMeeting. We're also going to talk to you about the clinical session structure, and then we'll wrap things up. So we're going to go ahead and get into it. Telehealth is defined as the mode of delivering healthcare services and public health via information and communication technologies to facilitate the diagnosis, consultation, treatment, education, care management, and self-management of a patient's healthcare, while the patient is at the originating site and the healthcare provider is at a distant site. Telehealth facilitates patient self-management and caregiver support for patients and includes synchronous interactions and asynchronous store and forward transfers. Further, telehealth is not a distinct service, but a way that providers deliver healthcare to their patients that approximates in-person care. The standard of care is the same whether the patient is seen in person or through telehealth. So in English, that means telehealth is basically a mode of service delivery, but it changes nothing about the service inherently. So we're still providing ABA. We're still providing sessions to clients. We're just doing it via telehealth instead of via direct service. There's kind of two ways on the next slide that we are going to use telehealth at ALP. So one is direct service, one-to-one. That is you guys, BTs, going into homes previously, right, that we're now going to be doing via telehealth. There's also telehealth that is supervision. So you may have clients where you're still going actively into the home and your supervisor is just providing their supervision via telehealth. So those are the two ways. If you're providing direct service via telehealth, your supervisor will also be supervising via telehealth. So based on the funding source, you may be asked to provide sessions via telehealth or not via telehealth. These are the three main components of telehealth that you'll be utilizing. So this is GoToMeeting, which is the software that we're going to be conducting the video and audio portion of session. Central Reach, which you guys are already used to with data collection and scheduling. The last component is going to be devices, right? Because you're going to have a device to conduct the meeting, and hopefully you would also have a separate device to collect data on Central Reach. We're going to talk about this more. Ideally, you would have two devices, but if not, it will work if you only have like one device and it's your phone. It'll totally still work. So we'll talk to you a little bit more about that in the future here in a minute. How do you know if you're going to be providing sessions via telehealth? Cases that are currently on hold may be returning to sessions via telehealth, or cases where parents have asked to limit the contact with BTs or supervisors may also have already transitioned to telehealth or may continue to make those transitions. Your supervisor will notify you if your case is being transitioned to telehealth. If a family asks you about telehealth sessions, please redirect them to the supervisor. Not all funding sources are allowing it at this time. And although you may think your client is perfect for telehealth, it really is a clinical decision that requires the supervisor and oftentimes funding approval to be able to conduct sessions via telehealth. As far as providing telehealth, once a family has consented to telehealth, the supervisor will request an account for you with GoToMeeting. You will receive an email with those credentials from LogMeIn or GoToMeeting. They're the same thing. It's just how the emails get sent out. So BTs will create the daily meeting and end the meeting as scheduled by client services. So that means your session starts at 3, you start at 3, and it ends at 5, you end at 5, just like it says on your schedule. BTs will provide parent with the meeting ID and links as needed. BTs will also provide a text message before session, priming the parent of session, and at the end of session to confirm that it has been concluded. We have some basic guidelines for you as far as the format of telehealth services. Most important, first thing, is that GoToMeeting is a HIPAA compliant platform that ALP has purchased to allow us to conduct secure sessions. If there are any technical difficulties with GoToMeeting, we cannot utilize any other video conference software. That means we cannot use FaceTime, Skype, Zoom, or any other private software. We must utilize the GoToMeeting account that was created for you by ALP. Also, you will create the meeting for the exact start and end time of the sessions that have been added to your central reach. You are responsible for sending a text to parents 5 to 10 minutes before the start time to prime them, and then immediately following the session to document the end time. Some more guidelines here is once you have been given GoToMeeting credentials and you log in, it will redirect you to the GoToMeeting hub. That's what's on the right here for you to see. You can access GoToMeeting on your phone, on your computer, or on your tablet. Ideally, the BT would have a computer to run GoToMeeting and your phone to utilize Central Reach. However, if you do not have access to multiple devices, you can use your phone to conduct the GoToMeeting, and you'll take data on paper and then transfer it onto Central Reach. The BT does need to be on video throughout the session, so please make sure that you're in a quiet room that is well lit. Also, remember that it is important that we maintain privacy while we're working from home, so you will need to be alone and uninterrupted during your telehealth sessions. Headphones may really support with this, right? That just gives you that extra added security, like no one else can hear this because it's in your headphones. There is a mute feature on GoToMeeting. Please mute yourself when the client is talking or if parent is talking to prevent feedback. Also, if clients engaged in like a sustained attention task where you're not going to be providing an instruction for a few minutes or 30 seconds or something, you can absolutely mute yourself and then click it back on. BTs can also screen share with GoToMeeting and are encouraged to utilize the feature for reinforcement for clients as appropriate. Please make sure that you close all other tabs and programs running on your device so those things don't show up when you screen share. Next, we're going to be talking about how you create a GoToMeeting. So GoToMeeting has a website, which will be in that email that you receive from logging in. There will be a link and it will redirect you to the website. Once you get to that website, it typically prompts you at the top to download the desktop app for GoToMeeting. We recommend that you do this if possible, since it's just easier to utilize. So on the GoToMeeting app, the desktop app, and this looks very similar on the phone app, you would select schedule a meeting, which is the middle button on that first picture. And you're going to fill out the meeting details, which are what pops up and is reflected in that second photo. So you're going to want to double check the date, the time, and then make sure that you're calling the meeting something HIPAA compliant. So this would be initials of the client, session, whatever it is. And then you're going to hit that save button. It will automatically open in Outlook with an email invite already typed up so that you can simply fill in your parent's email address and email it if that way works well for them. Make sure that you utilize your ALP email. So if you have multiple Outlook accounts on your computer, or if your default email app is not Outlook on your computer, it may open another one. So just make sure that you're sending those messages only via your ALP Outlook. If it does not automatically open your Outlook or it opens the wrong app, you can go to My Meetings, which is circled in this first photo on the right. You can select the session from the list and click Invite, and it will pull up the details where you can copy and paste them. You should be emailing or texting this information to the parent before each session. You will need to create a separate GoToMeeting each session. Unfortunately, for security reasons, GoToMeeting doesn't allow you to reutilize the same code or create like a recurring meeting code at this time. That is a part of HIPAA compliance. So you'll have to make a meeting for each session and those links each time. If you're on the GoToMeeting website, it opens to that GoToMeeting hub that we were looking at earlier. And then on the left side of the web page, which is pictured on this first picture here, it says create meeting in like a blue tab. And then you fill out the new meeting form. Again, making sure to use a HIPAA compliant meeting title, the date, and then confirming the start end. This one is duration instead of end time. And you'll also want to make sure that you have selected a one-time meeting. Like I said, we can't do the recurring meeting option because of HIPAA. So the meeting will appear on the right side of the hub page, and the BT you can take a screenshot of that and text it to families, or you can copy that invitation and then email it. If you guys don't already have your family's email addresses, please make sure to inform your supervisors that you would like to email them and that you don't have the address so that they can provide it to you. Some of the cool features about GoToMeeting. So on the left here is the control panel for GoToMeeting. This will automatically open when you start a GoToMeeting. So there's three main features at the top. This is going to be your mute button, screen sharing, and your webcam. Okay. The mute feature, we do encourage you, like we mentioned already, to mute yourself when the client is speaking or whenever you aren't providing instructions. Background noise, such as like dogs barking, lawnmowers, all that stuff, we understand it's life, it happens, but just muting yourself so that that is limited as much as possible is much appreciated. The second one is screen sharing, which will allow the client to see your screen. And this is, again, we'd like to remind you to ensure that you have monitored your tabs and you only have up tabs that are relevant to session. The last one is your web feature, and this should be on for both of you. So you and the client both need to be on video throughout the session. Again, we understand that sometimes parents need to step away or kiddos engaged in a task and your face on the screen may be distracting. So there is a pause feature on the webcam, but you will need to try to limit the use of that. We also want to encourage families, like a lot of the time families will want to pause that webcam feature when clients engaging in behaviors or when something else is going on. We want to encourage them to leave the webcam on so that we can provide support during those times. On the next slide here, there is some other advanced features I wanted to show you guys. So the first thing is the audience view tab. And this is in the screen section. So when you're looking at this menu on the right here, underneath each, there's a written menu. So underneath like the screen one, there is a screen, the word screen. And when you click that, it will allow you to see all of the screen controls. And then underneath this white section, there's a tab that says audience view. And if you select that tab, it will show you like a little screen over there in that control panel of what your screen looks like to the other person. There's also a chat feature. So this may be helpful when you're communicating with parents and you don't necessarily want to say something out loud to the client. This also may be like a fun reinforcement type activity that you can engage with the client as well, is like typing them messages or letting them type in there and send you funny messages. That's underneath. So underneath audience view, it says attendees and it will show you all of those in attendance. And then underneath that is the chat feature. So if you select it, it will open up the little chat box. Other cool things are the drawing tool. So at the very bottom of this right-hand side control panel, there's like above the meeting ID here at the bottom, there's like a mouse, and then there's a pen and a highlighter. You can draw on your screen with that pen or highlighter. And then also you can allow the client or the parent to draw on their screen by clicking on those three dots in the bottom right-hand corner. And it will allow you to give control to the client. If you are using a Mac, this looks a little bit different, but all these features are still, there's just like a separate little pull-out menu that comes out for it. So just be aware of that. If you are utilizing a Mac, it looks a tiny bit different, but all these controls are there. As far as the verification of sessions, since you cannot collect signatures on CR, right, we are going to be placing a place for you in the conversion notes to note that session was conducted via telehealth and that you were unable to obtain a signature due to that. Those verification forms, if you have already been conducting sessions, you may have heard of these verification forms. Those are no longer required. So you won't need to keep filling those out. We do recommend that you are sending a text message at the conclusion of session, just like you did at the beginning, to let family know that the session has concluded. And that way will also serve as documentation that your session ended at that time. But there's no need at this time to complete those verification forms. We do also recommend that you leave in your logbook notes in that team communication log section, that you also leave in the note that it was a telehealth session and the start and end time of that session. So just as a reminder, what we've talked about so far is we're gonna set up the session on GoToMeeting first. Then you would send a link to parent, prime the parent 5 to 10 minutes before, and then start the session at session start time. Number 4 is going to be conduct the session. And 5th, you're going to convert and add those session notes. Now we're going to step into more about step 4, which is actually conducting your session.
All right, thanks so much, Joey. So we want to give you a little background information as to what occurred prior to that one-to-one session that you're going to be conducting. Typically, a supervisor will already have gone in and adjusted goals. So those are our lesson goals or our acquisition goals, as well as the BIP. So you do want to go in and check that out prior to your first meeting with your first one-to-one session with the child, because you may have things that have been adjusted. You may be a part of a basic assessment meeting. That is really on a case-by-case basis, whether a supervisor wants a BT in that meeting or not. So look out for that. Your first session might look different than another BT's first session. You should review those procedures and changes made by the supervisor and make sure that you're looking at those prior to that first session. And of course, make sure that you're communicating with your supervisor. They should be attending your first session with you. We realize that this is a big change for a lot of people, and so having your supervisor there is just going to make you feel more confident and be able to ask more procedural questions, just like when you start a brand new case. So what happens when you actually get to conducting a session? So I want to premise that every single case is going to be very different, and every single case is going to be a combination of you working with the child through the screen or you working with the parent through the screen who's working with the child. They're all going to be very different. And so this is just a general conducting the session. What we do want you to do and encourage you to do is reach out to your supervisors, because they're going to have more specific information for that child. But in general, what you want to do is you want to make sure that you're establishing a schedule for session at the beginning. Your supervisor may have already set this up, so you do want to check those notes and make sure that in the procedures, we don't have a schedule that's already been set up. You're going to probe that client's attention, make sure that they're able to attend to the screen, determine how reinforcement is going to be provided to that client. This may be very different than your typical reinforcement schedule. Again, going back to that BIP and those notes that your supervisor leaves for you. Go ahead and select the goals you plan to run, and in that work period, be prepared with those materials. Communication is really, really needed for this. When you're going into the home and conducting regular one-to-one sessions, you don't need as much preparation, because it's something you do on a daily basis. You go in, you make this happen. Parents aren't needing to provide lots of materials. You go into the therapy room, you grab the materials. This way, we're going to really need to prep prior to. So communication with the parent is definitely needed. You will need to collaborate with that parent on how reinforcers are administered. So for example, if a client already had a token board in the house, go ahead and utilize that token board. That's one less thing we have to change for the kiddo. So the parent would just be the one providing that token, or possibly if that child has the skills, they may be providing their own tokens for reinforcement. If they do have a structured reinforcement system in place, this is something that you can continue to do, but do talk to your supervisor, communicate with your supervisor if you feel that something is not as successful as it should be. You will still be expected to collect data on CR. If you are unable to, because you don't have two screens like Joey was talking about earlier, you may utilize a scratch piece of paper. Be very, very certain that you do not put any client information on that piece of paper. And then you can always use the last 15 minutes of session or last 30 minutes of session to add in your lesson data from the paper to to CR via your device. You can also reach out to your supervisor if they suggest doing it every 30 minutes or doing it every 10 trials or 30 trials, whatever it might be. Just make sure that you're communicating and getting that data in. If at all possible, having two devices is probably your best bet to make this easy and successful for both you and the client. But we know that's not always possible, so we have a backup kind of plan in place. Keep in mind during your sessions, there's going to be a lot of parent involvement. We're kind of taking advantage of this situation in that our parents are going to learn a lot during this time. And they're really wanting to learn from you. They are in a place where they're spending lots more time with their kid. And so they really want to be able to learn from you. So be engaged and make sure that your parents are involved in these sessions. Certain goals are going to require parent involvement more than others. So if there's stimuli involved in your lesson, your parent is probably going to need to manipulate that stimuli, since you can't kind of put your hand through the screen and make that happen. So you want to communicate with the parents so they're aware of what the expectation is. Hey mom, we're going to be doing 30 minutes at the beginning. Here's all the stimuli you need. We really need you present. And then, you can leave me with Joey on your own, and me and Joey will hang out together, and his brother can come in and join us as well. So you're giving her kind of that outline when you're setting up that schedule at the beginning. So make sure that you are providing that expectation to them so they know they're going to need to be present for the majority of this session. Again, you're expected to collect that data and record those notes on CR. Because there's a lot going on, you are going to require some adjustments. Please be sure to know that this is a new thing. So we aren't too worried about you guys doing perfectly the first couple of times. We're not even worried about you doing perfect throughout this entire process. What we're looking for is you being more comfortable from session to session. Just like, your first BT session you ever had that was really scary, walking into a few more, you've gotten more comfortable, you're able to handle things a lot better. This is exactly the same thing. We're walking into something new. We're going to get more comfortable as time goes on. Know that your supervisors are going to be making adjustments ongoing, and so you should continue to check your supervisor's notes. And you also should include in your notes every session that does include telehealth. You need to write within the notes that this session was conducted via telehealth. This is just a sample lesson structure of how you would do things. So for a lesson structure where a caregiver runs that lesson in person, maybe there's lots more stimuli involved or whatever the reason might be. You're going to propose this lesson, make sure the parent understands the SD and what we're looking for, set up the device where you can see the stimuli and the child as best as possible, and then just go for it. Have the parent provide the SD, and you'll provide guidance throughout, coaching them on things like reinforcement, providing prompts, guidance throughout, those kinds of things. Make sure that you're very engaged during this time. You aren't sitting back and just lollygagging. You're not just watching, you're really engaged. The client should know you're there. The client should know that you're providing reinforcement, provide praise during that time. Make sure that you are still taking data on every single trial as if you were the one providing that SD. Another sample lesson structure that might take place is a BT running a lesson via the video itself. This is going to happen with our kids that are able to attend to a screen for longer, or higher level kids that are able to understand Maybe it's conversational skills that you're working on, things that are very easy to do via a screen. You're going to create that lesson schedule, set up the device where you can see the stimuli if there are stimuli involved, and the child, and give them feedback to adjust as needed, just like you would in any session when you're there in person. And then go ahead, provide the SD, prompt as needed, provide the reinforcer like you would typically in session. And again, make sure you're taking all data on all trials. If your client is a communicative client, ask them what they need from you. Ask them if they need to see you better, if they're not seeing the stimuli well enough, whatever it might be. Communicate with them too. All right, moving forward. Here are just some general tips for success. So prior to really getting into the nitty-gritty of session, really strategize locations for the device that's going to be used. What I found to be best are devices that are easily movable. Laptops, iPads, other tablets, phones sometimes are a lot easier to handle than a desktop computer. Having to redirect a kid back to a desktop is probably going to be a little bit difficult. Have materials handy. So make sure that the parents have materials handy and ready to go, not that they're disappearing for 10 minutes away from the screen looking for something that you've asked them to get. You can also utilize your own side. So it's still a video. If you have 2D stimuli that you want to show them, you can share your screen. You can show them the stimuli in your hand. It doesn't necessarily mean that the parents have to handle all of the stimuli. Share your schedule with the caregiver and take their suggestions into account. So if they typically have lunch at 11 o'clock that you're not used to, make sure that you're taking that caregiver's suggestions into your schedule and making sure to adjust for them. Stay positive throughout session. Again, this is new to a lot of people. There's going to be hiccups along the way. That is guaranteed. If you're able to stay positive and you're able to provide that guidance and encouragement throughout, you're going to see less parent frustration. Parents currently are going through a lot right now. They've got lots of changes going on in life. Many of us do, but for them, it's been a very big adjustment, having their kid with them all day long. So providing that encouragement, guiding them throughout, making sure not to be too harsh on them. They're still learning. They're not you. You're a BT. You're able to do this, and this is your number one job during this time. But parents are also dealing with running a household and keeping a job and everything else. So keep that in mind. Be positive. Encourage them throughout session. You can also step away from the kid and have the parent sit with you on the device and model some of those procedures. So show them how an SD is supposed to be for a specific lesson. Parents are going to have a lot easier time with the screen as opposed to a child. So you're able to model it before, make sure that the parent is set up, then send them off to conduct the lesson while you watch and take data and encourage. And you're going to have a more successful trial block, or you're going to have a more successful activity for that parent and the child. Utilize your own device for reinforcement. So show online videos, screen shared games. You can watch YouTube videos together. Like Joey was saying earlier, you can draw on the computer. So you're going to actually do like tic-tac-toe. Share your environment. So it's really cool. They actually get to see you sitting in your home. So maybe you have a cool picture that's on your desk, or you have something that you would like to share with them. Have them share their environment with you. So the same way in which when you're there, hey, you got a cool new game. I want to see it. Can you show me? Those kinds of things. So utilize that. Yes, you guys are in different environments. You're in different places, but kind of sharing it as one space is going to be really reinforcing for that child. This is a novel thing for many of them. And make sure you're collecting data. We want to make sure that we're providing opportunities. We want to make sure that we're also taking the opportunities that are presented naturally within the environment. So when a parent gives an SD that you didn't even ask them to give, take data on that. So if, let's, for example, say the child has an eye contact program for attention bid. So the parent says, hey, Joey, and Joey looks over at them and you're like, hey, that was one of the goals. Take data on it, because this is still something that's occurring during your session. All right, moving forward. Again, I've stated this multiple times, but I think it's worth saying again. This is very novel. All of us are learning as we go through this. supervisors alike, supervisors, BTs, directors, all of us at every level are really learning this new modality. So please do reach out to your supervisor if you have questions. Create a partnership with them. Learn as they learn. A lot of the things that we're doing are brand new, so don't be discouraged. Do your best. Nobody's expecting you to be perfect. There's going to be hiccups, and we get that. Stay positive and definitely communicate those concerns that you have. We really take BT's suggestions to heart. It's very valuable what a BT has to say. You guys are typically the ones that are spending the most time with the client. So getting to know what your suggestions are, what your concerns are, is really of the utmost importance to many of our BCBAs. And again, like everything, it takes lots of practice. Your first couple of sessions may not go well, but encourage the parent, encourage your supervisor, everybody around you that, hey, this is just the first couple of sessions. Everything is going to be moving forward and we're just going to learn. It's like riding a bike. We're all just going to get on, we're going to fall a few times, and then we're going to be able to get on it and ride. And that's really what we're looking for. We're extremely grateful for you BTs who have been very dedicated and super patient while we're trying to get this process rolling out for you. We're doing everything we can to keep you updated and informed as all of this new information becomes available, but please don't hesitate to reach out if you have questions, concerns. If you just have a general knowledge, you have anything to share, we'd love to hear that as well. All right, so please do contact your supervisor or clinical director. You can also reach out to the telehealth team and reach out to the support center if you have any questions as well. Thank you so much for attending. We really appreciate you and hope that you found this to be very informative. And again, thank you so much for your dedication and patience during this time. Have a good one.